1460 WVOX.
Now, from Whitney Media, 1460 WVOX and WVOX.com, this is Westchester Yesterday, Today, and Tomorrow with Michael Dandry. Join Michael and his guests as they look at the heritage of the county and the issues facing Westchester today. And join in the conversation at 914-636-0110. Now, Westchester Yesterday, Today, and Tomorrow. Here's Michael Dandry.
Okay, welcome to the show, and the focus today is on Blythedale Children's Hospital. It's a specialty hospital, very unique specialty children's hospital in New York State, one of only 14, I believe, in the country, according to the wonderful material that Justin sent to me. And the focus is on Blythedale and in general, which has a 125-year record of service in Westchester County. And helping me explore all the services and the people there includes Dr. Scott Klein. He's the medical director at Blythedale, and nurse, registered nurse, career nurse, Suzanne Bartlett, and her daughter Christine Bartlett, who are here under unique circumstances. Let's say Suzanne and Christine. Suzanne is the mother, and Christine is the sister of Stephen Bartlett, who committed suicide last year. It's almost a year since that took place. A little over a year. And instead of being sidelined with perennial grief, Suzanne and Christine are out and have participated in a program called Talk Saves Lives, a suicide prevention program, and are really designing it as they go along, from what I get. Okay, right, Christine? Is that true?
Yep.
Okay, and so the subject today is a little bit on the heavy side, but encouraging also, in the sense that Suzanne Bartlett and Christine have used their life experience to walk out their front door and help other people. And I think that's terrific. Absolutely wonderful. I don't know where to go with this now because, take us to the press conference that I saw last month was May was Mental Health Awareness Month.
Right.
And you both participated in a press conference at Blythedale, which I did see on television. That's why you're here today, because I was so struck by actually the succinct message that you had, in that press conference. You don't get a lot of time to extrapolate on a lot of stuff of why you were there. But do you want to give our listeners, a review of that press conference, or why you're doing what you're doing?
Well, May 8th was the day we had the Talk Saves Lives, and my daughter spoke and introduced everything, and I spoke a little bit. And that was actually the first year anniversary of my son Peter's death. So I just felt the best way to honor him is to spread the word and educate people. And Talk Saves Lives is a basic course through American Foundation of Suicide Prevention that we're working with. And it just gives a lot of the basics of how you can help someone if you think they have a mental illness or are feeling suicidal, and what to do, what not to do. And, my son's life matters. And going forward, he's going to always be remembered, and he's going to change lives through Christine and I. And I believe that. And through the support of Blythedale, who've been so supportive in getting this initiative going. And I've been at Blythedale for 25 years, and they've always it's the most supportive place you could ever work. So I really appreciate that they are behind, the whole program that we're trying to do. And we're going to bring in other different courses. This is just the beginning.
Right. And I'm very grateful that you're here today to announce that. Now, Christine and Suzanne and Dr. Klein, you can jump in if you'd like to. Is there a focus where, let's say, there might be an educator or someone, a clerical person listening to this broadcast who want to know more about what you do, or have you come and speak about what you're doing? Where can people reach you beyond, at Blythedale proper?
People can email me at sbartlett@blythedale.org if they want to get involved. Our plan is to offer different training sessions, especially also for parents, different members of the community. One of our groups we're going to work with, and my main focus is really on youth because I've always worked in pediatrics and young adults. I mean, I want to help everybody who's suicidal or has mental health issues, but for me, you have to pick a kind of a focus. So another group that we're going to start working with is the Youth Mental Health Project. And they have different programs. They have parent support groups to empower parents of how they can help their children. So that's another step that we're taking. And once we start offering courses at Blythedale, we'll, through social media and that, we should get the word out of what courses, and how they can register.
Right. Let me ask you a personal question to Christine especially. Do you sit in a room like this, a little conference room, and talk about what you're going to do next and how you're going to say it, how you're going to give the example of Stephen, of blessed memory here? In other words, coming up with a program is not easy in this. You have to, I guess, marry experience with techniques and all. So how do you go about constructing a program? It's got to be very difficult.
Well, we started a committee at Blythedale, Mental Health Awareness and Suicide Prevention Committee. So we're we have a little a core group that's meeting and come up with the plans. And I think we have, and we actually want to contact the school that's on site also. And for example, my daughter from the outside, and there's a mom who I'm in a bereavement group who would like to get involved with, whose son died by suicide also. So I think we have psychologists, social workers from Blythedale. I think we bring a lot to, a lot of our ideas are going to come together. So it's all in the planning, the beginning stages, but I think that's the best way to go through what's the best avenues for us to take.
And Dr. Klein, I would say that, having a professional nurse who would many years of experience at Blythedale Children's Hospital involved in this is a tremendous asset, because you have interacted with thousands of patients and children over your career, so you have a you do have a sensitivity to a lot of different topics involving the health of a child. So I mean, that's got to be a tremendous advantage in this educational outreach effort that you're making.
Yes, it's certainly, Suzanne is more than just a nurse. She's the driving force behind this, and I think that's how often the tide gets turned for these kinds of programs, is when there's somebody behind it that not only is the stimulus, but the person who's going to maintain the momentum needed to not only come up with ideas, but then actually operationalize it. Without that, often these things are hard to maintain.
Right. Now, Blythedale obviously has a 125-year record as being a specialty children's care hospital. Was there a mental health component all of these, for a number of years in the practice there at Blythedale?
So for us, mental health, behavioral health treatment is not a primary treatment that we do. However, there are many scenarios where children will have significant behavioral health needs when they come to Blythedale. Some could be children who have pre-existing mental health conditions, who maybe got into a car accident or had cancer or something like that, and then coming to us for rehabilitation. And obviously we needed to know how to not only manage their illness, but also their behavioral health needs that often get exacerbated.
That's true. There are many different strands of this. As you hear, the theme is coming on, and we are taking a very brief break, and we'll be right back.
Welcome back to Westchester Yesterday, Today, and Tomorrow with Michael Dandry on 1460 WVOX and WVOX.com. Join Michael and his guests as they look at the heritage of the county and some of the issues facing Westchester today. And join in the conversation now at 914-636-0110. Now, Westchester Yesterday, Today, and Tomorrow. Once again, here's Michael Dandry.
Okay, welcome back to the broadcast. In case you just tuned in, the topic today is really a double-headed somewhat. We are focusing on Blythedale Children's Hospital, a specialty hospital with a 125-year history in Westchester County, which helps make Westchester County such a great place to live. And Dr. Scott Klein is here, the medical director there. And accompanying him is Suzanne Bartlett, a registered professional nurse at the hospital, and her daughter, Christine Bartlett, who are here under other auspices. Suzanne Bartlett is here as a parent of a young man who took his own life, Peter Bartlett, and instead of retreating to a deserved grief, and privacy, both Suzanne and Christine have stepped forward. Last month, I saw them on television launching a suicide prevention program with a dynamite theme, actually. Talk saves lives. So Suzanne and Christine and Dr. Klein are here to help us, to inform us about what they're doing, and in case anyone out there has a situation or wants to know more about preventative treatment. So thank you for coming and sharing your life experiences with us on the airs of WVOX, WVIP. And again, it's hard to take a root on this topic. I would say to Suzanne and to Christine, what was your resolve to step forward? In other words, how did you feel about doing that?
I didn't think of it any other way, but I know some people don't speak openly about, somebody who died by suicide or has mental health issues. And I think that working at Blythedale, it's always been easy for me to talk about it because it's just such an accepting place of children. So I always was comfortable to speak there. The only place I was never comfortable to speak about any issues Peter had was at school, because honestly, parents would judge kids like him. And it came out in many, parent meetings that I was there, but everywhere else I was very honest about it. Just because I felt, as a pediatric nurse, we have to talk about these issues. We can't hide it. And when he died by suicide, it was not, I just didn't hide it. I just knew I had to make a difference, I remember Peter one time when I was a little boy in the back seat of my car saying, Mommy, if something happened to me, would anybody remember me? And I think it was after 9/11 that he said it, and I said, you're not going anywhere. I mean, you're a little boy, but you lost my thing. You will matter. And I feel like that even stronger now. Everything we do it under the Peter, you matter. And it just matters. He's going to help change lives, and we're going to be just the vessels to do it.
Right, you and Christine, with help of Dr. Klein and professionals and all, are keeping him alive.
Yes. That's how I feel.
That's the way it appeared to me at the press conference. I was so impressed by your presence and your ability to. It's not easy, by the way, once you get into this media business, right? It isn't. No, because you have to impart a lot of content in 15 seconds, 30 seconds, 60 seconds, and it's not easy to summarize all of your feelings in that context. It isn't. It's easy to sit around in the living room and talk narrative, So I admire the fact that you're mastering that. And can we go back to what you had earlier said about the school? You found a resistance from the parents.
Well, I can give you an example.
The parents of Peter's friends.
The parents in the classroom.
And the classroom.
I mean, Peter would be turning 27 this Sunday. So this is, a while ago, back in second grade, and he, the teacher he had, she said, I worked in special education, I worked in the BOCES program, I'm coming here, I bring a lot of experience. And two different parents raised their hand and said, are there any like that in this classroom? Like, how could that be? Why, we don't want our kids around that kind of feeling. And I knew right then I could never be open. I couldn't raise my hand as much as I wanted to because my son had to go to school there, where it would have been my, that was my first, yes, right. It was. But in other ways, I would always talk about it. But that was really hard because I think Peter was so brave in many ways because he had, a lot of different things go on. He was bullied. kids knew how to pick on him. He was on medication at one point, and he would have reactions that really were not his fault. And I never made excuses for him, but I mean, the fact that he could walk back into a classroom every day when school was really tough for him, I just think that takes bravery.
And confront that situation.
Yeah, nobody really has an idea, like to go in there and say, oh God, what's going to happen today? What are they going to pick on me about now? Terrible things they picked on him, one boy especially. So, I just think he was
under the worst
courageous.
circumstances.
Yeah, under the worst. Like, people know when to get somebody who's vulnerable. Don't you agree, Christine?
To Suzanne and Christine and Dr. Klein, do you want to give an overview of what we're talking about nationally? Right before the broadcast, we were talking about in the green room. Who wants to address that, the big picture of what we're talking about as far as adolescent and suicide nationally in the country?
Well, in the youth 10 to 24, and it actually really goes up from 10 to 34 years old, it's the second leading cause of death in the United States.
That's shocking. I don't think people realize.
And it's probably even higher than that, because if you take opioid addictions, that could be somebody who's self-medicating. If somebody dies and doesn't look suspicious of a drug overdose, you don't know if that's a suicide. I mean, all of it links together. Mental health goes together, opioid addiction, suicide prevention. We have to address it all, or we're just not going to get anywhere. And like I had said to you, right now, and every year, the statistics are going up. There's over 45,000 Americans who die every year from suicide. And there's over 45,000 Americans who die by suicide. So in New York, which has the best or least amount of suicides, one every 5 hours there's a suicide in New York. So that's still unacceptable. Every other disease process is going down except for suicides.
Right, and you had mentioned inside in the green room that New York at that rate is the 50th state.
Right.
So everything above that, I mean, the heartland, apparently there's a lot going on there too. Dr. Klein, you want to address that geographic imperative?
Yeah, I don't know if I could necessarily have great theories on to why the different states vary so much, but again, one of the difficulties obviously is reporting, and I think that what we've seen over the last decade through social media and just media in general, there's so much more availability of information, and it's hard to tease out how much is really increasing versus just increasing awareness. But certainly the stressors being placed on teenagers is tremendously different than 20 years ago.
True. And it does seem that funding for mental health causes of any nature is now, a somewhat of a problem, because the need is this. Again, I'm talking now about an observer. The need seems to be incrementally increasing. At the same time, the funding, public funding for this situation is either static or needs more funds.
I agree, and I think also when you have younger people, bullying doesn't cause suicide. No one thing causes suicide, but
Good point.
When you're already vulnerable for whatever reason, my son knew that he had learning disabilities, school was hard, that kind of thing. I remember, I can't think of the doctor's name. It was a book I had read about for Peter, about learning disabilities and that. And he said, if you have $1 and somebody takes 50 cents away from you, that affects you so much more than if you have $10,000 and they take 1,000. It doesn't affect you. But when you have so little to hang on to, now you have social media and kids get bullied on social media and that. And we really have to address what's happening in the schools too. We have to have every grade has to have mental health, but we have to have a really good program. There's no program set.
Well, that's where you come in, you and Christine and Dr. Klein come in to try to ameliorate that situation. There's our theme again. I guess we're
Okay.
taking another break. We'll be right back. Thank you. Okay, welcome back to our listeners. And of course, the heritage of the county includes Blythedale Hospital, who has been providing services to children. It's a standalone hospital in Valhalla for 125 years. And by coincidence, Suzanne Bartlett is here, registered nurse and in charge of health care at Employee Health at Blythedale, along with her daughter Christine Bartlett, who is a pediatric nurse at Maria Ferrari, which I just learned during the break here, and Dr. Scott Klein is the medical director at Blythedale. So that's the heritage of the county, and here we're here today because of the Bartletts, because of Suzanne Bartlett and Christine Bartlett have stepped forward from the loss of Peter Bartlett, Suzanne's son of blessed memory, to suicide, and instead of being sidelined by grief, they've stepped forward to start a very important educational program, suicide prevention program. Talk Saves Lives. So that's why they're here. Let's turn the attention over to Christine Bartlett, who's sitting next to me here. Christine, share with us some of your thoughts about what you're doing, and you have a medical background similar to your mother in nursing. So share with us, your life now under these circumstances.
Well, it took me a while to want to kind of get involved in doing programs like this, just because I feel like when you lose someone to suicide, you have all these what ifs and did I do everything I could to help him? So learning that there are programs that exist like this that I wasn't involved in before he died was a little hard for me to accept. But over the past year, I just see the stigma of mental illness so much, and I want to be able to do what I can to break that down. My brother struggled with mental illness for basically as long as I can remember, and just seeing how people treated him, not knowing what was really going on, it was and still is hard for me to accept. And especially, my mom has been battling cancer now for almost 5 years, and to see the support that she gets for her illness as opposed to the support that my brother didn't get is just something that I want to be able to kind of break down and have people realize that just because it's not an illness, you can see that it's still, people need all the support to get through it themselves as well.
Right, it's still an illness. It's definitely still an illness. And, somewhat in the country, Dr. Klein, I'm trying to get you involved in this. We compartmentalize everything. We have Black History Month, we have Women's History Month, Mental Health Month. And sometimes I think it gets in the way of topics, because we conclude that May was Mental Health Month and it's over and moving on. Now, what you just said is very, very important to me, because this topic, as your mother had mentioned and Dr. Klein had mentioned, is rampant throughout the country. You would think that that suicide among young people is a number 2 cause. That more people would be aware of it and more open to modalities of treatment, and less susceptible to rejection of people, because the population is so large. So that I find to be a somewhat of a contradiction when you compare the data of what you're telling me here in the studio. If we had the same rates of diabetes or something, there would be no controversy, but because it's mental health, unseen maybe, except with playing out of a personality, it's really shocking when you think about it. So to me, that's kind of like the realization that you came to as a medical professional yourself, Christine, in that way. So, again, you and your mother are constructing an educational outreach effort. So I assume that your personal experience with this topic, Peter's illness, his life experiences that he had, go into that mix now. Is that what's happening to you both?
Yes, definitely. Yeah. This is, it's so personal.
Right. It
you
is
know.
personal, but it has a resonance among a large catchment of people.
Right, right. And it's just time that enough is enough. I read something, if somebody was in a crisis, a mental health crisis, and you go to a doctor, say you had a huge gash through an artery in your leg, they would put, a tourniquet on. They would watch you. They would admit you to the hospital. They would do whatever they had to do to stop that bleeding. What happens in mental health? They'll give you pills and say, come back in 6 weeks, not knowing if you're going to have side effects, which can happen. You don't know if it's going to work. Maybe it is getting recognized more, but there's not enough places for people to go either. So it's all very difficult. But
So really, your campaign theme of "Talk Saves Lives," which I saw on the press conference, is is germane to what you're both saying. It's literally start with talking, and whether it's at this radio station or on cable television or whatever, is a step in the right direction. I
agree.
would hope.
Yes, I think so. Thank you so much. And one thing that even came out in Talk Saves Lives that they present, like how do you take away things that can cause suicide? Like you do those preventative measures. So, for example, it could cost $8 to have a carbon monoxide detector installed in cars, and nobody could use that as a form of suicide. It would shut the car off, and car dealers will not do that. So it's such simple
It's another
things you
issue,
can't even
right.
get. You know what I mean? Like there's so many. Why? It just doesn't make sense to me when you talk. They just are not accepting of what the brain is as big an organ as anything else. If our brain doesn't work right, we got our brain and our heart that would need to really work right, and we're ignoring the brain here.
And the brain and the emotions and all.
Yeah.
Now, Christine also and Suzanne. Obviously, Peter was treated by a number of different kinds of people, psychologists and psychiatrists over the years, because he had some continuing problems from adolescence, from what you had told me
Well,
before.
even younger.
Yeah, younger.
Yeah.
Okay. Did they rally around you after the suicide? In other words, to offer not necessarily condolences, but insights at all into what we're talking about?
Who rallied around?
The people that may have treated him over the years.
I don't know that they know.
Interesting.
Yeah.
Interesting.
I didn't contact them.
Okay.
And his last doctor, we had to do, the only way we could get him the medication that he actually needed when he was finally diagnosed with bipolar, we had to go through telehealth. So he had one appointment with that doctor, and I don't
That's
know how
remote.
to get in touch.
Yeah, telehealth is
remote,
pretty
which was
remote.
great. I mean, it was the one way we could do this, but no, not. I mean, I do want to contact St. Vincent's because he had gone there, and that's where he was diagnosed with bipolar. And I really would like to reach out to them because they really had a great intensive day program. I just haven't gotten there. Some things I avoid still.
You're entitled.
Yeah, I just go through my grief in my strange ways, but.
You're entitled. You're entitled. And to some extent, for what Christine was telling me before the broadcast, is that her brother trusted her, so they had a wonderful rapport, a wonderful relationship. So that that had to be that has to be now a source of somewhat comfort, I would hope, to you, Christine.
Yeah, I mean, it definitely helps knowing that we had such a good relationship, and that even though he felt very shut off by the rest of the world, I was someone that he did trust, and that even though I didn't know all the right things to say or do for him, I know that I did everything I could with the tools that I had. So, and that does make me feel better.
Well, you use talk as a means to try to get through to him, okay? And that's what you're trying to do now with encouraging other people to take up that method of interacting with another person. Mm-hmm. Really, when you think about it, I find it so interesting that the last 6 months I've been reading about efforts being made in England to highlight mental illnesses among the Prince Harry and Prince William,
Yes.
about their own depressions following the death of their mother, and that they had all of these suicidal thoughts too, because the future seems so bleak.
Yes,
So-
and I know they're working on a program with
They
Oprah
are.
too.
They
here.
are. There's our theme again. We are taking a brief break, and we'll be right back. Thank you. Okay, welcome back to our audience. And today the topic is actually it's an encouraging one. Suzanne Bartlett is here. She's a professional nurse, and along with her daughter Christine Bartlett is here also, who is a pediatric nurse at Maria Ferrari. We have Dr. Scott Klein as the medical director of Blythedale Hospital. And the topic is preventing suicide. Young people, especially young people. So I keep introducing the different segments to the fact that Suzanne and Christine are trying to overcome their continuing grief, the loss of Peter Bartlett to suicide, by stepping out of their grief zone to impart their knowledge about the topic and to talk about it and to go out into the public and to launch a preventive program. So thank you for being here and sharing very personal experiences. And again, it's hard to decide where to go with this, because other than during the break we were talking about you developing materials that will be sent out to various organizations. You want to mention that the group that you talked about during the break, the youth?
Well, I think there's a lot of groups already out there that you don't have to really invent the wheel, but learn how, everybody work together. So that's like with American Foundation for Suicide Prevention. We have Talk Saves Lives. They have another course we're going to offer, Youth Mental Health First Aid, which is an 8-hour course that could be used for educators, healthcare professionals, etc. That's another one we're going to bring in. We are also going to be working with, I've spoken to already, the Youth Mental Health Project, and that really helps to empower parents in mental health awareness and what they can do to help their own children. And, they have other resources, but it's a lot of resources to really help young people and, preteen, and adolescents, and bringing parents together, creating support groups for parents that the parents run, and they help each other work through things. And, and then hopefully, like with NAMI and Mental Health Association, I even use that if people call me and say, besides the suicide hotline number, if somebody's really in crisis, but if you're having issues, Mental Health Association and NAMI have chapters everywhere that really can help, maybe guide you of where to get professional help or, guidance for parents. And I really think it wasn't something that I had, but I think if parents have support and know, okay, it's not just me going through this, you can relate to me, that just helps your own emotional health, because it's a tough thing to really try to help somebody who has mental health issues, and they might not be willing to, get the help because of the stigma and everything, and especially for males, it's a huge stigma.
Right,
that needs to go away.
It still is with all that's going on, And Christine, you want to add to that? You're a medical professional. You're a pediatric nurse. So, you went through medical school. Is there any help there? In training, for nurses and doctors, Dr. Klein and Christine Bartlett, to flag these problems for potential physicians and nurses in the future?
Well, I think what we have at Blythedale, as far as, Dr. Klein could talk about the evaluation of the people coming in with the suicide, the prevention tool. And they were actually just talking about it today, like all doctors really should be using that, just because you never know.
It's one thing, even if you could identify an issue, the harder part often is to know what to do. And
correct.
What do I do with that information? And whether it's a family member or a patient. For us at Blythedale, what we've been working on, again, because we're not a primary behavioral health institute, but we have many children who have significant behavioral health needs in addition to their rehabilitation and other health needs. And so sometimes in the course of treatment, a child may say something that triggers a concern. And what we've really been working on is how to have frontline providers, not psychiatrists or psychologists, but non-behavioral health workers, be able to know how to field that question, tease out the seriousness of the question and then make sure the child then gets to a psychologist, a psychiatrist, somebody who then can actually take it to the next step.
The follow-up.
Yeah.
The follow-up is very important, obviously. But this is a huge subject that we're talking about. It really is when you think about it. But then again, looking at the stats are so enormous, you would think that there would be more solutions,
Yeah.
given the stats alone, and which is somewhat surprising. I don't. It's very difficult to to focus on anything but the positiveness of your efforts.
And I think there's hope. There's a lot of hope.
That's what I'm getting
Yeah.
at. Obviously, there's hope if Suzanne Bartlett and Christine Bartlett are out there into the community. They're here at the station. They're going to be out in the community and sharing their personal experiences with other people in order to help them. I think that's terrific. We have one very short segment. Is there an email? Is there a website where people can get back to you on this topic? And any of the three?
I mean, people can email me. Like I said, it's S Bartlett, BARTLETT at Blythedale.org. And I'm assuming going forward, when we have our programs, they will also be on Blythedale's website.
Yeah.
Okay, and this is very important, Christine, the fact that Blythedale is putting, obviously, their experience and their prestige behind this effort. I think that's terrific. That's another benefit. Thank you.